This will continue our lecture this week on abuse of elderly and disabled persons, Chapter 12 in the Barnett text. This is the second part of this week's lecture, and we're looking here focused upon practice and policy issues, as well as a few issues regarding special populations towards the end of this particular presentation. The detection rates are a problem in terms of treating elder abuse and recognizing it and that type of thing. And one of the things the text points out, it isn't so much university training in these kinds of things that help you in detecting abuse rates. It is more whether or not you've had experience as a professional caregiver. More and more experience as a professional in general, I would think, would be even the point here that you begin to get a sense of situations that are risky over time, and oftentimes can have more of a sensitivity, I believe, in acknowledging or recognizing signs of abuse. Nonetheless, I wouldn't be doing this lecture and teaching out of this particular chapter if I didn't think that it was useful for you and that there was good information here for you to take with you. And so bear with me here over the next 30 minutes or so as we look at the last half of this particular chapter. As practitioners obtain greater understanding of the precursors of elder abuse, they then should be able to protect potential victims more readily, according to the text. So that's almost a contradiction to what I just got done telling you, but nonetheless, here are some victim and perpetrator risk factors that the authors identify in the text, both listed kind of by category, and you see that there are many similar characteristics, similar areas, I suppose, that characterize both victims and perpetrators, and one of those areas is dependence on each other. The victims oftentimes are dependent upon the abuser. Sometimes the abuser is dependent upon the victim for financial gain or for whatever reason that might be, and that creates a tension and a certain neediness. It certainly tends to lock people in a relationship, which can create some resentment and friction in that relationship. Psychological disturbances or physical or mental frailties, frailties among the victims, disturbances in the perpetrators. Psychiatric problems or a history of substance abuse in both categories tends to be one of those precursors of elder abuse. For the victim, social isolation, but still living in a situation where they share their living situation with the perpetrator. In this particular case, history of abusiveness, with both being abused as well as being abusive, I think, for the perpetrator, and again, being more or less forced to share their living situation with their victim. One interesting note, as we talk about how to deal with perpetrators and treat them effectively, that the authors have found that batteries intervention programs don't tend to be as effective in treating this particular population of perpetrators like it is in treating the population of younger batterers. And this is something we haven't yet covered in this course, but we will be when we look at the chapter on batterers, that is, batterers intervention. The information from when you look at the legal aspects of this and the court involvement is not very encouraging. Prosecution is rarely successful. It's very rare that a prosecution goes beyond the initial investigation phase, and a lot of the reason for that is because sufficient evidence is just not present in order to take a case to court. The Elder Justice Act was passed in it was a bill that was introduced in 2003 in Congress, but has been hung up, stalled in Congress ever since. And this is an act that would strengthen and add laws to protect elders, but for whatever reason, it doesn't seem to be able to make its way through Congress. And having access to legal services is something that's very important as elders become involved in the court system and protecting themselves or become more dependent upon others. Elders need attorneys to help them put together good orders of protection, or to ensure that guardianship orders are done properly, that if an individual is identified as a representative payee, that is to get their money and to manage their money for them, It's something short of being an adult guardian, but gives another person control over an individual's money and that individual's access to that money. All these kinds of things, as well as protection from involuntary commitments to mental facilities. These are things that oftentimes elderly people need attorneys for in order to make sure it's done properly, and they can be taken advantage of if they don't have the right kind of legal advice and legal guidance in these areas. And finally, laws protecting elders against financial exploitation need to be overhauled as well. So, oftentimes, this is the crime that's perpetrated by adult children who generally have access to the money and live with them. And when the adult children are the perpetrators, again, I want to say adult children, as a rule, do not exploit their parents financially, but abusive adult children may. The New York legislature passed a standard of care that is owed to a principal in an adult guardianship kind of situation, and some of the things that the caregiver, or in this particular area, they're referred to as the agent. So it could be a representative payee as opposed to a caregiver. These are some things that the agent should provide for the elder, which is who's referred to as the principal here. That first, they act in the best interest of the principal, that they keep the principal's property separate from their own property, that they keep records of their transactions on behalf of the principal, that they make records and a copy of power of attorney available upon request by key persons. That could be, adult protective services. It could be relatives who are concerned about their elderly relative, whatever. And really generally that the agent avoids any conflicts of interest or potential conflicts of interest in managing the financial affairs and the properties of an elder person. So these are some things that probably could be used as a model in terms of ensuring that whatever agreements are put in place, that this is a good model for the agent understanding what they should be doing to make sure that it's done properly on behalf of the elderly person. Professionals in coming in contact, and the textbook talks about medical professionals, and I have to add social workers and home visitors in healthcare programs, and which is really a medical person, but hospital staff and social service departments, those kinds of things, really should get in the habit of routinely ask elderly individuals that they're coming into contact with some questions that screen, and some basic questions. For instance, are you afraid of anyone? Is anyone mistreating you? Those kinds of things. But sometimes when you ask those questions, when you don't ask those questions directly, the victim isn't going to bring it up. And so asking those questions directly assures that at least you've touched on that topic. The victim might still choose not to respond in the affirmative if it's going on, but nonetheless, you're at least giving that person a good opportunity to tell you. And this should be conducted in private. And at the same time that you're doing these screening questions, you look for these red flags of abuse. And here's a list of a dozen and a half different kinds of things that in and of themselves probably do not indicate abuse necessarily, but they can be red flags that tell you to screen carefully and to put this information together with other things we know about the elder person's or disabled person's situation, so that you might be able to uncover some things that are going on that is otherwise not known. The text points out that although emergency medical services personnel believe that they can recognize the signs of abuse, they don't think that it happens as often as it does, and so the implication of this is that EMS personnel might miss signs of abuse frequently enough. And medical personnel, and I hope not social service personnel, but medical personnel tend to be reluctant to report suspected abuse because of the outcomes of the reports. They don't like, oftentimes doctors don't want, well, first of all, they don't want to lose control of their patient, and they might. And this is a thing with doctors, is the fact that they really do want to have a control of important things in their patients' lives. And so calling in the authorities sometimes intrudes in their abilities to continue to manage their patient's medical condition, and they sometimes will be reluctant to report because of that. They don't particularly want to see their patients' lives disrupted from their current home situation. They don't necessarily want to see the caregivers involved in the court system or the legal system for whatever reason. So there's a number of reasons why doctors sometimes won't report, and this is an area where mandatory reporting is something that needs to be put in place in every state. Currently, the textbook believes that the biggest area that is in need of collaborative work is between the Adult Protective Services Unit and domestic violence shelters. Now, older women can go to women's shelters, but women's shelters don't tend to be set up for the needs of elderly women. They're more for mothers and children and women of childbearing age, let's say. What they need more is more access to healthcare facilities, and the textbook does talk about the possibility of taking women's shelters or rather assisted living facilities and kind of turning them into battered elderly women's facilities as a sort of a great combination of the two. And it suggests that the women's shelter programs and APS professionals can collaborate to develop those kinds of facilities. As we learned with Hurricane Katrina, there was some real tragedies involving elder individuals in nursing homes during the Hurricane Katrina thing. The evacuation just didn't happen properly, and so there needs to be adequate policies developed for that as well. And the text also points out that law enforcement needs better training and understanding and working with individuals who are suffering from dementia and Alzheimer's degrees, and also better funding for their responses to elder abuse. The American Association of Retired Persons did a study in 2007 that found that the courts were oftentimes not following the usual procedures that are put in place to protect individuals' rights when it came to abuse cases for whatever reason. Judges and court personnel need to be trained in aging and abuse and the issues related to that. And just like with victims of domestic violence and children who are abuse victims, attorneys need to be available. Pro bono attorneys need to be made available. Volunteer attorneys is, I think, how the textbook puts it. In order to help the elderly negotiate and deal with whatever comes up in the court system in their situations. There is a fragmentation of service delivery for elder abuse protection, which needs to be addressed on the community level and perhaps on the state level as well, so that an APS worker from Anchorage contacting somebody in Kenai may have less resources available to them than, say, someone in Juneau, or that kind of thing. And the services that are in place may not be coordinated so effectively to work together in the case where steps need to be taken to protect a vulnerable elderly person in someone's home. Just like with child abuse cases, multidisciplinary teams seem to be the best form of response to the problem of elder abuse, which has many different sides, the legal, the medical, the social services, the advocacy side, those types of things. And so these multidisciplinary teams, or MDTs as they're called, will meet on a regular basis and discuss cases together and look at coordination issues between them, and oftentimes provide much better interventions and services in specific cases such as this. There's also some communities have appointed death review teams for what are referred to as gray murders. These are things where elderly people die, and there's a belief that some of them may have been actually the result of abuse or some sort of a homicide action, but it isn't recognized because of their age, or nobody looks at it. They assume it's natural causes, and so death review teams in some communities review the medical information that comes out of the autopsies and police investigations and things around the deaths of elderly individuals, and can sometimes perhaps uncover murders that were undetected otherwise. And another innovative intervention that some communities are developing, the police law enforcement agencies establishing the financial abuse specialist teams, or FAST teams, which again take a multidisciplinary approach to dealing with issues and cases related to financial abuse of elders. For prevention, the textbook talked about the efforts to raise public awareness about elder abuse, and particularly among the elderly individuals, so they know that they can step forward and protect themselves, that certain things are not acceptable, and to understand where their resources are. But what they found that wasn't so effective, nor was necessarily the home visits by social service organizations or medical personnel who come to the visit, come to the home to see the elderly person, because that person still may not know to speak up. But what they found is most effective is a combination of the two. That public awareness along with the home visiting programs seem to be the most effective way to encourage our elders to identify and report abuse or neglect. In addition to being aware of the red flags about possible physical abuse, for instance, that we had seen a few slides back, professionals should also be aware of signs of financial abuse, which include things like the elderly individual making changes to beneficiary statuses and their policies, having new friends, having their spending patterns change, their bank statements taken from them, that kind of thing. Sometimes if it's apparent that an individual has more money than but still their care isn't kind of living up to that standard of what it should be, this could be a good indication that somebody is taking their money. And so these are things, again, as a professional intervening with elderly individuals, it's important for you to keep in mind. In these situations of financial abuse, the typical scenario that the text talks about, and we know some situations like this if you watch the press. I mean, just pick up Entertainment Magazine. There's usually some aged old billionaire who's married to some very voluptuous 20-year-old model, and everybody thinks it's because she wants his money. And this is probably more common than we want to realize. And a much younger person marries a wealthy senior, maybe isolates that elder person from his or her children and other relatives, people that they usually had relationships with, sort of dominate that person's daily living, gains access to the bank accounts, makes themselves a beneficiary in their will or jockeys so that they get access to a share of their estate after their death. This is financial abuse, even though the elderly person may be voluntarily entering into this relationship. And as you can imagine, that's a very difficult thing to prove in court, and to have the court support when the elderly person, apparently in sound mind, changes beneficiaries and disowns his children in favor, or her children in favor of the new young thing that has married them. So the bottom line is that seniors need to be very careful in choosing a responsible person for their power of attorney. And whether that be legal advice or having a trusted relative or adult help them make that choice. It is something that should be done with people observing and assisting them. One special population the text talks about late in the chapter is same-sex elder abuse. This is among the gay, lesbian, bisexual, and transgendered population of elders. And there really isn't much known, and really I don't find the information in this text very helpful with this particular population, because it says there isn't much known about the interpersonal violence among same-sex or against gay, lesbian, bisexual, transgendered elders. Probably are not a lot of studies done on it, and so it's not the author's fault. But the fact is that this abuse often goes undetected, and if it is detected, unassisted. There is little doubt, the authors say, that being a gay, lesbian, bisexual, or transgendered elder is a risk factor for abuse. The text also talks about cases of what they refer to as legal discrimination, against GLBT elders. These things exist, in such thing as denying services to seniors, denying long-term partners eligibility for health coverage, or to be identified as a beneficiary for Social Security benefits. These are all things that are enacted by the governments or by corporations, that don't recognize the relationship between these individuals, even if it may have lasted decades and decades. Um, and finally, GLBT seniors often lack a supportive family connection to provide them with social support and aid when they need it, because family members often not knowing how to deal with their sexual orientation, perhaps, and having isolated those individuals, or the individuals having isolated themselves over the years. There are a few pages devoted also to different factors related to different cultures around the world, and I'd refer you to the text for specifics. Again, not a lot of information in any particular culture, but just sort of a little taste of issues that might arise from one culture to another. It is clear that the abuse of elders by caretakers is a worldwide phenomenon, and there are concerns that professionals who work with elder abuse victims in the United States, particularly those from other cultures, really don't have the cross-cultural competence they need to be effective in those works. So this is an area that is something that is worthy of attention. There are different kinds of things that happen with in other cultures too, in addition to the things we're more familiar with when it comes to elder abuse, including things like accusing individuals of witchcraft, abandoning them altogether, isolating or hiding the elder, or those kinds of things. Finally, we spend a little time looking at the more specific population of the disabled individual. This can include elderly individuals, can also involve children, and certainly the larger population of disabled individuals that we will be talking about here are adults who are incapable of caring for themselves. Persons with disabilities represent about 1/5 of the population of the United States, but there isn't much research data about the abuse of that particular population. The data is probably there, but isn't pulled out, and the authors say that has something to do with what they refer to as the invisibility of handicapped persons in our lives, that while we know they exist, we really just don't want to deal with them. We don't really have them in our social circles, and unless we're specifically hired to work with that population, oftentimes see them as a population that is for another agency, that developmental disability, that DD agency, to take care of, not us. The Census Bureau defines disability as sensory, physical, mental, or emotional conditions lasting 6 months or more that make it difficult to perform activities of daily living, such as walking, climbing stairs, dressing, bathing, learning, or remembering. The assumptions that we have in our culture, our society, about disability, such as the fact that disabled persons cannot function in the workplace, is the one example, kind of set up a lot of the problems that they have in our culture, because we have that assumption that they can't work in the workplace. Employers don't tend to want to create jobs for disabled individuals to work in, things that they could do. The local Safeway in Soldotna has for years, in fact, had employees, disabled individuals, to work in their store, bagging groceries and stocking shelves and things like this. These are things that they're certainly capable of doing, but might not be able to be hired and keep up with the pace in other in other businesses and things like this. As a society, we tend to oppress, devalue, and dehumanize disabled women in particular, but also disabled men, which makes them very vulnerable to abuse by others. With this particular population, some additional kinds of things also are added to the kinds of abuses that vulnerable adults experience, including terrorizing, severe rejection, isolation, using physical or medical restraints, withholding basic kinds of services like bathing, feeding, toileting, that kind of thing. And there are a number of points here about the abuse of disabled persons in our society and in our system. For one thing, disabled persons are more likely to be abused than non-disabled persons. Disabled women suffers more abuse than non-disabled women, and suffer more abuse than disabled men do. So again, if you're a female and you're a disabled female, the risk of your being abused is higher than any other population. Homeless and severely mentally ill women experience victimization rates of 97%. This particular population, homeless and mentally ill is extremely vulnerable to abuse. And when disabled women suffer abuse, they tend to suffer it longer before they can get out of the relationship than non-disabled women. And it's something like, if you look at it, it's 50% longer, it seems. I don't remember the specific percentages, but it was something like 50% longer. The sexual assault rate of disabled women is twice that of non-disabled women. And part of the issue, of course, with sexual assault is the capacity to provide consent for sex. That determining that capacity becomes kind of the focus sometimes when there are investigations involving a sexual assault of a disabled person who might have been seduced and consented to sex when they really don't have the cognitive capacities to be able to make that consent knowingly. And so that's an area that complicates interventions in cases such as that. Perpetrators also, with this particular population, we have to expand the list of perpetrators to include non-relative caregivers and strangers, because these are individuals who are called into the homes of disabled persons, or who run homes where disabled persons live, or in institutions where disabled individuals live on a daily basis. And so while they're not immediate family members, nonetheless, to those individuals, they're as important in so many respects. And while the text says that the interesting thing is there's really no significant danger in reporting abuse to police, like in other words that disabled persons are as likely to report their abuse as non-disabled persons, or at least as to be reported. More disabled persons will tell you the police didn't respond to their calls than among non-disabled. So wrapping this up also, we look at finally individuals disabled or elderly who live in long-term care facilities, and this really does include both populations. And the authors point out that there is not adequate care, and the lack of adequate care and abuse that occurs in our nursing homes in this nation is what they refer to as a national disgrace. And sexual abuse is a particular problem in some long-term care facilities, and I don't want to say that this is the case with every long-term care facility, nursing homes and those kinds of things. There are many facilities there that are high quality and that function with good standards, but there also tends to be a rather large group of facilities that are problematic. And so among sexual abuse, most of the victims in these long-term care facilities are females, and most of the offenders are employees of those facilities. Some of them have criminal records. The second largest group of offenders for sexual abuse are other residents, and it points out that sometimes we have registered sex offenders living in those facilities, and so that's an area that needs some attention, I suppose, as we, if you come to work in a facility such as that in your career. And the facilities often are operating under some real handicaps of their own, through inadequate funding. And it isn't so much the funding, I think, the pay that keeps people working there, but because of the inadequate funding, there is a big turnover. But it's not so much the pay as it is the quality of the facility and the atmosphere of the facility that tends to reduce the turnover rate among employees. And so hiring good people is one thing, keeping them is another thing, and that's one way to cut down on the rate of abuse in facilities, is to have a stable staff that you get to know well as an administrator and that you can count on. The largest percentage of individuals providing patient care are certified nurses assistants, or CNAs. And they are also the employees who are most likely to be abused by the residents themselves. And the text spends some time talking about the fact that CNA programs need more funding. Facilities need to have more supports put in place to help their CNAs. And CNAs themselves need better training. And when you look at the problem of abuse in long-term care facilities, only 21 states, as of the writing of this textbook, maintain a central registry of abusive workers. And so it would be relatively easy for individuals who may not be convicted criminally of any abuse, but still who were abusive of the disabled or elderly individuals in their facility, to move to another facility and get hired and start over again. So lots of areas for attention and concern in this particular with this particular population of disabled and elderly. As a social worker, I think I mentioned to you early on that it was once said that the largest percentage of people with social work and human services degree at one time or another will work with children. I would also add that a large percentage of the people that are listening to this lecture are likely to wind up working with disabled and elderly adults, whether it be in nursing homes or assisted living facilities or long-term care facilities, or it be as family members of individuals that they're working with and that they visit on a regular basis. And so this information is something that I think is important to kind of tuck away in your folders and to hold on to, and to stay updated on as you work through your career over the next many years ahead. That will conclude the lectures for this week, and I hope that the information was useful to you. If you have questions about any of this, please contact me and let me know. Otherwise, we'll talk again next week. Bye for now.